I had some dental work done almost 15 years ago. Lots of veneers and crowns, which have now been discolored. I've had several replacements, so I have various colors. And then 2 years ago I had to have 2 dental implants, which, so now none of my smile matches. I have a midline just kind of going this way. I have discolorations from medication when I was younger, so I just want a whiter and prettier smile.
Karen came in to see us for a new patient examination, and she was looking for a new smile makeover. I think her initial interest in finding us was for something more than just the ordinary dental checkup. She was looking to find somebody who knew a little bit more about cosmetic dentistry. We went through a 21-point smile analysis, and we found that there were exposed root surfaces, there were uneven lengths of teeth, there were some crooked teeth, in addition to the tetracycline stain, which was a banded, double-colored tooth stain.
I think I had been told before the newer techniques that the bleaching really wouldn't help that, so I'm hoping now that it will.
She had one of the most difficult kind of cases you'll ever have because she was banded. She had 2 colors of teeth. She had a very yellow area near the gum and a very brown area near the top. And when you're doing bleaching, you're always going to worry that before you finish, you're going to always end up with these 2 colors, but just lighter. And so you hope that the bleaching is going to even out the color instead of having 2 colors that are just lighter.
It was a little bit of sensitivity, but overall I got some really good results. I had some really bad stains from the tetracycline, so they were kind of hard to get out, but it did go a lot lighter.
Well, we were going to do a combination of veneers and crowns on 11 teeth. And so we had to go through the deep bleaching process, and it turned out spectacular.
It's really nice to look and see them much lighter than they've ever been. My top teeth are going to have, I think I'm getting 5 new crowns, 6 veneers. I'm getting all my fillings replaced, so it'll be a white filling instead of the silver that's in there now. So all look clean and white.
When you do your veneers, you're taking off a thin layer of tooth, maybe about 2/10 to 4/10 of a millimeter of the enamel, and you're putting back a layer of porcelain just like you're doing a contact lens approach. In order for us to do a reconstruction, we take a mold of the teeth, and we take an ideal mold of the teeth after we have studied it and prepared it in the lab. We make an ideal mold of the teeth. Then we go back and prepare the tooth in the mouth to the ideal structure, and then we take an overlay of plastic and put it inside the ideal mold and put it on top of the prepared teeth. From that, we make temporaries where we can see exactly how the person is going to look after we finish. The patient loves their temporaries. They go home looking like great teeth already. The colors are improved, the shapes are improved, and they get to try out the look of their teeth before they actually get them put on. And so the temporary phase of doing the reconstructions is a very important step. When they come back, we take the temporaries off and we bond on the crowns, we bond on the veneers, and they leave with the permanent teeth that day. Okay, Karen, bite down on that. That's great. Oh, that's good. We'll make sure it's... And we're putting Karen's crowns on today, and her crowns are going to be cemented on, and they're going to be put on with a cement that is very strong. It's going to be something that is thin, so that there's a very intimate contact. There's not going to be any space between the crown and the tooth. We put the veneers on the same way. They're bonded on, and they become intimate with the tooth. You can't tell where the crown starts and the root starts. It's supposed to be one smooth, flowing junction. That's what makes the gums be so healthy. If you have a very fine fit, then the gums accept the restorations very well. What I want you to do now is check your bite. Let's see how you're looking. Go through there and just chew and slide around. Now bite down. How are they looking? They feeling good?
Mm-hmm.
They feel even to you?
He's been really great.
Okay.
The staff has been wonderful here. just overall exactly what I wanted, and they listened to what I wanted, so it's been wonderful. I was really looking forward to pictures, because even with the temporaries, I had a few pictures taken and got them back, and I was like, even the temporaries look so much better. So I know that, you know, the permanent teeth will look great. So I think just in pictures, it's going to look wonderful. These look great.
I've really enjoyed working with Karen. She's been an excellent patient. She's followed every rule. She's done every procedure right. She's been great with taking care of what she needs to on her end. She's got very good health in the gums. She's got a very good smile now, and I'm just totally proud of how she looks.
It's a wonderful feeling. I've always had something that I've looked at and said, oh, I need to do that. That would look much better. So this is great to have everything done that I've always wanted.
From the first visit, you know, this office is run so professional and just such a warm and welcoming and comfortable atmosphere.
Well, Dr. Williams is the best dentist I've ever had in my life.
I don't dread coming to the dentist anymore. I don't have butterflies in my stomach, you know, when I know that I've got an appointment coming up soon. I don't dread it.
I can walk in the door and sit down and I'm greeted by wonderful people.
My experience has been wonderful from start to finish, and I definitely intend to be a patient way into the future. I would like to always stay with Sewanee Dental Care.
Yeah, Dr. Williams was so trustworthy and did such a great job for me that I was able to bring my family in and not be afraid that my daughter would have a bad experience.
Dr. Bill Williams is excellent as far as his staff, his chairside manner, so to speak.
I'd recommend it to anybody. I feel great about it now, that's for sure.
I feel no hesitation referring them to anybody.
I think a lot of people in general don't want to come because of pain. So if that's the case, like with me, then they definitely need to come and see him.
It's like getting a double dose of, you know, you get your dentistry done, but you also meet and have new friends and people that really care about you.